This CME is going to focus on a couple of topics, one being communication, two being assessment, and three being treatment of our patients. Now, so as you can see from this slide, the face of EMS has certainly changed. And that is pretty much what we're going to be talking about today. We'll be talking about assessing our patients while in full PPE, treating our patients in full PPE, as well as communicating not only between ourselves, but also to our patients. It's certainly not an easy thing to do, and these are challenging times, and we want you to know that we recognize that. So our objectives for this CME are as follows: awareness of COVID-related mental health and wellness for first responders, understand the communication dynamics between patients and other practitioners, and also the proper assessment and treatment during this COVID timeframe in our lives. We want you to know that we understand that donning all of this equipment, taking the time that it takes to put on all of this equipment, certainly requires a certain resiliency during this period. We acknowledge that, and we understand how difficult that is. We also understand that every time you respond to a call and you have to put on just our baseline PPE, we understand the psychological challenges that we face as first responders. It's not our normal go. This is very difficult. Not only is it difficult, it's constantly changed. And we've only been dealing with COVID in our area for approximately 75 days. And a lot has changed just in that period of time. We went from responding to our calls in our regular t-shirts, shorts, uniform shirts, to all of a sudden we're in masks, and now we're in full face masks. And now you take a look at across all agencies, everyone is in a different style mask depending upon what their agency has or does not have. We have gone through such a large amount of change in a short period of time. It will desensitize the best of us. We understand that. We need to kind of reel ourselves back in a little bit and first acknowledge that, yeah, this is challenging. This is very challenging, and it's not fun, and it definitely messes with our head. The face of EMS and the way we treat has changed. We get that. How far it's changed, we don't know yet. We don't know what changes that we have put into play today are going to change tomorrow. How fast it changes. But regardless of how many changes that have occurred and how many changes that may still yet occur, we have to understand why we are here. We have to understand what it is we were really called to do. And we have to maintain at all costs the human element. We have to maintain at all costs the human element. We are all human. This has an effect, COVID as a whole, this has an effect on all of us. We have to understand that we're human, and the patients who are calling us are human. We have to understand the fear that runs through everyone. Understand that fear, digest that fear, and then continue to do our job through that. Now let's take a look at us. How many challenges have we had to overcome just by virtue of looking at the different pictures in this slide? How many challenges have we already had to overcome? Kudos to each and every one of you. This is challenging. We look like aliens. Imagine what we look like to a 5-year-old, to a 10-year-old, for that matter, an 80-year-old. Things have changed. One of the ways that we overcome these challenges and we maintain that human element is through our eyes. Our eyes are one of the most important features each of us have. establishing eye contact and maintaining that eye contact is vital to maintaining the humanness within what it is we do every day. A simple question might be, can you see my eyes? That redirects your patient to you and redirects you to your patient just by virtue of simple eye contact. Another way to create a personal touch and overcome some of these challenges that we're talking about is in talking to your patient, ask them if they can see you smiling. So as you can see, there are many challenges that we need to overcome. Communication with our patients, communication with each other, and the PPE challenges we face, as you'll see in some of these videos. Recognize things, how difficult is it to speak to each other, let alone to the patient? How unsightly we look. How long it takes to put the PPE on, especially when it's a possible COVID or even a confirmed COVID patient. So another way that we are attempting to overcome these newfound challenges is through this clinician communication sheet. Now, each of our agencies should soon be receiving them. It's not a mandate that you use these sheets, but it's certainly going to help your treatment in establishing that human element. Now, as you can see, we have acknowledged many of the challenges that we as a system need to overcome with wearing and donning all of this PPE. How we treat, how we look. This slide here speaks to an extremely important topic, and that is avoiding tunnel vision. You see, wearing all of this PPE allows us to create a barrier from us to the patient. That barrier prevents us from properly communicating, properly assessing, and properly treating. We cannot allow that to happen. We have to first establish that human connection. We have to. And then we cannot allow our PPE to bar us from treating and assessing our patients. Please, be cautious of tunnel vision. As you will see in an upcoming video, just because someone is young, just because someone is a particular gender, just because someone doesn't seem to have COVID, or just because somebody has COVID, doesn't mean that there aren't other illnesses taking place. It's important for us to understand tunnel vision. So we taught tunnel vision in one particular manner. Fast forward all the way to 2020, and we're now teaching tunnel vision in another manner for a different reason. Understand our PPE and wearing this can cause us to not fully treat our patients. We cannot allow that to happen. You as a clinician cannot allow that to happen. We still have to treat our patients. We still have to assess them. We still have to start IVs. We still have to put the cardiac monitor on. We still have to interpret ECGs. We still have MIs. We still have strokes. COVID has not changed all that. All it did was complicate it. But we are up for this challenge. And I know that we're ready to handle what comes. Now, we went over a lot of information to better recognize and understand many of the challenges that we are now facing. And like I said, there will most likely be even more challenges that we have yet to face. Through all of this, we have to ensure our own mental health. We have to check in with ourselves. We have to check in with others. We have to maintain a plan to stay healthy. What is your plan? What do you do to stay mentally healthy, physically healthy, emotionally healthy? Stay connected to the outside world. Expect stress and keep it at bay. That's a big one. Expect stress and keep it at bay. That brings me to an interesting concept that I think a lot of people are misunderstanding, and that has to do with this so-called peak of COVID. Please understand that our government, our cities, our agencies, we as a people, we locked all of ourselves inside. We went through this major lockdown, closed businesses. We did all of these things not to stop, eradicate, or completely prevent COVID. We did this to just slow the progression. I feel strongly this is a misunderstanding. We didn't just do something to get over the hump and then all is well and good. That's not the case. We need to recognize that. We need to recognize the concept that this job is stressful. What we do is stressful. We get it. Recognize your own stress. Employ tactics to reduce your own stress, healthy tactics to reduce your own stress. And be proactive about mental health issues. We are really good at masking and hiding our feelings. We are really good at masking our stress. We are really good at masking any depression or any illness. And lastly, we have to be proactive about mental health issues. We need not hide these things under a rug, behind a rock. They exist. Take care of yourselves. Acknowledge that these are challenging times, but we'll get through them. There may be more challenges ahead, but we'll get through them too. Working together and bringing in the humanness to what it is we do. Acting out of compassion and empathy. That's what will drive us through whatever challenges we have yet to face. Thank you, every one of you, for what it is you do. It does not go unnoticed. It really doesn't. You make a difference. Each and every one of you need to know that. You are making a difference. And thank you.